My name's Jimmy Everage. I work for Goodyear in Fayetteville, USW Local 959. I've been there for about 13 years. Back in 1976, my father was disabled in the coal mines, and my mother was a work-at-home mother. And his compensation for his disability was $178 a month. At this time, my mother, she would pick up part-time jobs, to make money to help make ends meet, to get them a little nest egg. So when they retired, well, about 2 years ago, my father come down with cancer. And as everybody knows, health insurance and all that stuff is very expensive, so their nest egg was gone. When my father passed away, and the only income my mother had was Social Security, because she had just become able to draw. And now she's in a situation with a donut hole on her medication, and she usually has to pay about, I'd say, $2,600 to $3,000 extra a year, what the government won't paying her on a fixed income of $863 a month. Thank God that me and my brother are fortunate enough to have good jobs to where we can help her out to make ends meet. But just think about the people who don't have family and doesn't have the ability of people to help them, changing off, taking drugs every other week, skipping a prescription this month to be able to eat and pay the rest of their bills. My mother's always going to be taken care of if I have anything to do with it. But for people who doesn't have the ability to get help, it's going to close a hole. They're going to have a better standard of life because that's all the money out of pocket that they're not going to have to pay. I'm really big on the health reform. I wish it would take place quicker, but I understand things happen over time. And it would really help out the older citizens that's already done their life, work for us, work for our unions, work for our country, be able to sustain a better lifestyle when they get older. They don't understand that all of us is going to get older someday, and we're really unable to tell what our health is going to be in the future. You don't never know what's going to happen. And people who really think like that is thinking on a day-to-day basis and not the long term and not the betterment of our whole country or the whole world, really. It's very, very beneficial, but that's what we're here to fight for, a union in whole, not just my union, not just the tobacco workers, not anybody. We're all here to fight as a whole to get health reform to help out everybody. We're looking at the big picture. I would be even willing to pay more on my health insurance if it would help out the older Americans and the disability people in the United States.